are now eligible for vaccination against COVID-19. 5.5 months into our national immunization program against the coronavirus, India on Friday allowed vaccinations for pregnant women. On Friday, the Health Ministry announced that pregnant women are now eligible for the COVID-19 vaccines at any time of their pregnancy. The Union Health Ministry accepting the recommendations of the National Technical Advisory Group on Immunization to allow pregnant women to, and I'm quoting here, make an informed choice on taking the vaccine. But how do you make an informed decision about the risks from COVID-19 infections during a pregnancy and the benefits of vaccinations and the likely side effects of vaccinations? Well, tonight on We the People, we've put together an expert panel of doctors to help answer all of your questions and your concerns. We have first Dr. Gayatri Juneja. She's a senior consultant obstetrician and gynecologist at the Apollo Cradle Hospital of Delhi. We have Dr. Sunila Garg, member of the Lancet Commission of the COVID India Task Force, director and professor of community medicine at the Maulana Azad, the Medical College and Associated Hospitals, an advisor to the ICMR and also the WHO. We have Dr. Nihar Parekh, a pediatrician and the director of the CHIRS Child Care, and Dr. Ritu Petkar-Palve, a consultant obstetrician and gynecologist at the SL Raheja Hospital. So I'm opening up the show right now to our audience. You've been waiting patiently to put your questions across to our doctors. Thank you for that. First and foremost, Prajakta Navandar joins us. Prajakta, you are 7 months pregnant. I'm told congratulations. You know, Prajakta, I can imagine being pregnant in the middle of a pandemic, and the second wave in particular could not have been, joyful the way pregnancies should be. What's your story? Is this your first child?
Yeah, it's my first child.
Wow. So really, I can imagine how are you feeling? What have you been worried about? Your reaction to the fact that the government now says that pregnant women like you can/should be taking the vaccine. What have you done about that? Have you spoken to your doctor since then?
Yeah, I have spoken to my doctor, but I would definitely want to know what will be the side effects to me, as well as are there any side effects to my child? That's I'm sure the main concern every pregnant woman currently have. I would definitely want to know what will be the side effects for me as well as my child. Is it safe?
Is it safe? All right. So I think that's a question in everyone's mind. What led to this recommendation? We've been 5.5 months into our immunization program against COVID-19. And why now is the government saying that pregnant women should or can get the vaccine, right? What's changed? What's led to this change in this criteria of letting pregnant women getting vaccinated? What was different before and what's changed now from the past? Dr. Sunila Garg, could you take that question we had Prajakta asking, are there studies backing the safety of vaccines for pregnant women?
Thank you, Sarah, first of all, and congratulations, Prajakta, for a very, very important information and very good news. And we wish you all the very best. And number one thing which I would like to say at this juncture is that you see, now we have enough data. A lot of pregnant women have been immunized, with regard to COVID vaccines, and we found that particularly in second wave, the women who got infected, they had very severe infections as well. So you have to make the choice between the disease or between the vaccination which is preventing the disease. And your question is very, very valid, that basically if you take the vaccine, whether there will be any side effects of the vaccine with regard to yourself and to your child. Number one, I'll say that any vaccine, you see, basically by and large is meant for protection, right? So that is where you have to see that we, in majority of the cases, I'll say, plus the other way around, I'll say it is 0.00 some percentage which will have the adverse events following immunization, which can be otherwise also there. But also you have to look at from the other perspective. That means, you see, if one has COVID infection, one can give rise to low birth weight babies. As such, in India also we do have, high prevalence of low birth weight babies. That means babies who are born less than 2.5 kgs. And compounded by infection, this becomes much more higher. And also preterm babies are quite common and all that. But you see, at this time, I have to talk to you about very positive things. And at the same time, you have to make informed decisions. Yes. That is very, very important. Okay. So that's where you must know everything about the vaccine. And whenever you are going to the doctor for the vaccination, before that also you should read about the vaccine yourself. And also I will say that the vaccines are safe. That is how the decision has been taken by Ndtv, that is National Technical Advisory Group on Immunization also, and also SAGE, that is WHO Scientific Advisory Group on Immunization, both of which they recommend that now, pregnant women must take, because of the positive effects of the vaccine much outweigh the risks which are acquired due to the COVID vaccine.
So the benefits of vaccines for pregnant women, say doctors, outweigh the potential risks of it. So then what is the best time? Let's say someone who's just found out they're pregnant, when should they, within this 9-month term, should they be getting vaccinated? Dr. Gayatri Juneja?
See, as this is a very new disease itself, and studies have recently been released, and this is what we are following everywhere. Initially, we were following the guidelines abroad that if it has to be, they have to be vaccinated. We should vaccinate them after 3 months of pregnancy. But now, the latest guidelines have come that in animals, at least, they have seen that the vaccine is not affecting the embryo or the fetus. So it is safe to take the vaccine anytime in pregnancy.
Anytime. So you wouldn't recommend first trimester, second trimester, third trimester, anytime?
See, it all depends how many cases are there around her. If she stays in a hot spot, then definitely first trimester, second trimester doesn't really matter.
But then would you say the earlier the better?
Definitely.
So first
earlier
trimester.
the better. First trimester. See, what happens in pregnancy itself is, it's a condition where more than a normal woman, a pregnant woman has more chances of getting that infection. Plus, the immunity per se is low.
Yes.
So the earlier we give the vaccination, the better it is, so that she develops the immunity and she's safe throughout the pregnancy. And definitely that helps us in preventing complications, like ma'am said, about growth retarded babies and premature deliveries as well, which India itself has high risk. Indian people, they have high risk.
All right, Sanya Mithaiwala joins us. Sanya, you're a lactating mother. You had, congratulations, you have a newborn baby, a young baby.
Hello, hi, it's Sanya Mithaiwala here. Thank you for, first of all, congratulating me. And my question is, as I'm a lactating mother, I'm concerned about my baby. So I just wanted to ask that, is it safe for me as well as for my baby if I'm taking the vaccination? So please guide me through it.
Dr. Nihar Parekh, you're a pediatrician. Should new moms who are breastfeeding here, like Sanya, should they be taking this vaccine? Should they be waiting it out until they stop breastfeeding? Is this going to affect milk production in any way? Or, or is it better because, antibodies will then get passed on to the baby?
I think it's extremely, extremely safe for every mother to take the vaccine while breastfeeding. They should continue to breastfeed before taking the vaccine. They can continue to breastfeed immediately after taking the vaccine. It's safe to take a paracetamol as well, for a few days to wear off the vaccine effects. So I see it is extremely, extremely safe for every mother to continue breastfeeding and take the shot. I think they should. And about the antibodies, I think as and when the mother develops the antibodies, the passive immunity to the baby who's being breastfed of the antibodies going through the milk is absolutely of a protective nature. So as and when she starts developing the antibodies, the baby will get passive immunity too.
Okay, all right, Sanya, I hope that answers your question. We have Ameya Songadkar joining us from New York. Is that correct, Ameya? And you were studying in New York, but you have a cousin who's pregnant. You're worried about her. You're also, I'm told, engaged and about to be married in December. So what's your question? How come you're joining us on the show?
Yes, thank you so much, Sarah. Good evening, everyone. Thank you for having me on the show. So my question comes from a major concern that my fiance had not very long ago before she took the vaccine. What are the potential concerns for women who are trying to get pregnant or are planning to have a baby in the near future? Like, will the vaccine affect fertility in any way? Because she was very hesitant about taking the vaccine as she thought it might affect her chances of conceiving. And it kind of makes me wonder, have there been any studies so far on the COVID-19 vaccine on pregnant and lactating women? Like, have other vaccines been studied on pregnant women as standard procedure?
Dr. Ritu Palve? Dr. Palve, if you can hear me, are there concerns for... all right, Dr. Garg, would you take this question then? Are there concerns for people who are trying to get pregnant? There's some rumors, and it's really important that if this is not true, these are just rumors, we should nip them in the bud. Do vaccines affect fertility? What about people who want to have a baby in the future, in the near future?
Sarah, very, very important and a very natural question for him. You know, it is very important to understand that vaccine in no way it is going to affect your fertility or it's going to cause any harm. So it is important that she has taken the vaccine, as I can understand, Amya, your fiancé. So it is very, very good thing that if she has done, but there are no side effects in terms of any infertility in men as well as women. So that's where you need to be, very much, I'll say, you should be satisfied that she has taken the vaccine and there's going to be no harm. And and you asked, the second question was that have any studies been done? And since you are based in US and you're calling from there, lot of, vaccines have been given, both, Moderna and Pfizer to the pregnant women, and the outcomes have been very, very good. So that is where these women have been prevented from getting COVID-19 infections during pregnancy. So that's how, otherwise we will get, a lot of, side effects because of the vaccination. If they, because of the disease during pregnancy, they can have, low birth weight babies, or they can have stillborn babies or preterm babies. So it is better to take the vaccine because it is always going to be safer and preventing the pregnant mothers during pregnancy. And very, very important that lactating mothers, if they have not taken during pregnancy, they should take, because it prevents both mother, and through the milk, the antibodies can be transferred to the child. And
especially
we know
since
that
we don't have vaccines for kids, and certainly not for babies right now. So this is the only protection a newborn child can get really against the coronavirus. All right, we have Shashank Shekhar. Shashank, you have a question?
Yes, actually, the experts have established that vaccines are very unlikely to pose a risk to pregnant person or the fetus. However, while I was going through the articles on the internet, the long-term effects are yet unestablished. So if there are some long-term side effects, how are we going to keep track of that thing?
All right, so the question about side effects. If we have Dr. Ritu Palve joining us, Doctor, I'm not sure if you heard that question. It's a question about side effects of vaccines on pregnant women, pregnant patients taking the vaccine.
Yes, I heard that question, and I hope you're able to hear me clearly.
Yeah, we are.
Yes. So about the side effects, I understand that there are no long-term studies that are there because the whole disease is just about 2 years, 1.5 years to 2 years that we are looking into the picture. The effect that the pregnant women are having because of COVID infection, if we look into their severity of the illness, if we look into their ICU admissions, the mortality is very, very high in pregnant women as compared to looking at the side effects. It's an imaginary fear. Plus, there is no mechanism which says that there's a cross-reactivity that is happening in any sense to the fetus. And that's proven. The technology by which the vaccines are made, that technology we've already been using and giving vaccines like influenza, tetanus to these women, and there has been no issues. So,
but I think also maybe the question is about side effects. Everybody's been complaining of fever, temperature, drowsiness, a lot of tiredness. When you're pregnant and trying to look after yourself, maybe that is a worry that those kinds of side effects. The benefits still outweigh that?
definitely the benefits of being alive are much more than the side effects, which are probably just 2 to 3 days of illness and they're also very mild, like maybe there is just mild fever, there could be some pain at the site of injection. Also, there are certain
nothing that a Combiflam can't fix.
Yes, absolutely.
Okay, what if a woman has already